Hi everyone, welcome to the module on the introduction to the abdomen. In this module, we'll be talking about the abdomen in terms of the boundaries of the abdomen, the various planes in which we could divide the abdomen, regions, quadrants, and then contents of the abdomen. And then look at some case studies in terms of particular pathologies in relation to the abdomen. The abdomen is part of the trunk. It lies between the thorax and the pelvis. I'll show you a picture of how that looks like. It's a said to be a flexible dynamic container that houses a lot of organs, particularly organs of the alimentary canal and the urogenital system. So this is an image that shows various compartments of the body. You could see the compartment of the head, which is the cranial cavity running down to the spine. But more importantly, you could see the compartments within the trunk. At the top, you could see the thorax, which is one compartment, the abdomen, which is the compartment directly below the thorax, and then the pelvis, which is the most inferior compartment. And we'll notice how the abdomen is sandwiched between the thorax at the top and the pelvis below, all within the trunk. How do we distinguish between the abdomen and the other compartments? This talks about the boundaries of the abdomen. So the abdomen, in terms of the boundary, tends to be limited superiorly by the xiphoid process and the costal margin. I'll show you pictures of how that looks like. And then inferiorly, it's limited by the pubic bone and the iliac bone. So anything above the xiphoid process and costal margin is automatically the thorax. Anything below the pubic bone and iliac bone automatically would be the pelvis. Then laterally, the abdomen is limited laterally by the mid-axillary line. Then, in terms of some of the vertebral levels, just important to note, the xiphoid process and the costal margin tends to be associated with vertebral levels alongside the pubic bone. The xiphoid process is associated with the vertebral level T9, whereas the costal margin is associated with the vertebral level L2. And then the pubic bone is associated with vertebral level L5. So sometimes you could ask you about the vertebral levels of each of these boundaries. And it's important for you to know that. This is just another image showing us different compartments. And you will notice how the abdomen tends to be limited superiorly and inferiorly alongside laterally by those different boundaries I mentioned. Superiorly, I said, it's limited by the xiphoid process in the center, around there, and the costal margins at the side, around there. Laterally, it is limited by the mid-axillary line. So you have to draw a line through the middle of the axilla. That line will cut across the lateral boundary of the abdomen. And then finally, in terms of the inferior boundary, is limited by the pubic bone all the way down to the iliac crest. For ease of description, we tend to divide the abdomens into either quadrants or regions. So we could divide the abdomen into what we call four quadrants. As you can see in the image here, there are four quadrants of the abdomen. Or we could divide it more into smaller parts or regions. We could have nine regions of the abdomen. Now, what we use in dividing the abdomen into quadrants or regions are what we call planes. As you can see, uh, for the quadrants, we need two major planes, a vertical plane and an horizontal plane, and a horizontal plane rather. And then for regions, we could have a total of about four planes, two vertical and then two horizontal planes. We divide the entire abdomen into nine regions. Let's talk about the horizontal abdominal planes. So these are also called the transverse abdominal planes. We have a total of five different transverse abdominal planes: transpyloric plane, subcostal plane, transtubercular plane, interspinous plane, and then the transumbilical plane. In the formation of regions, we could either make use of the transpyloric plane or subcostal plane superiorly and the transtubercular plane or the interspinous plane inferiorly. So these are used in the formation of regions of the abdomen. We have nine of them. For the formation of quadrants of the abdomen, we prefer to use the transumbilical plane. Now, what are each of these planes? Let's start with the subcostal plane. Subcostal plane is the plane that tends to run through the inferior limit of the costal margin. It is related to the 10th costal cartilage and it tends to lie at the level of the inferior border of L3. So in terms of the vertebral level, it's found at the inferior border of L3. And this is one plane we use in the formation of the region, as I said initially. If we are not using the subcostal plane, another plane we prefer to use would be the transpyloric plane. Transpyloric plane, compared to the subcostal plane, is a little bit superior. Transpyloric plane tends to pass through the inferior border of L1 vertebrae. That is contrast to subcostal that is passing through L3 vertebrae. Transpyloric plane also tends to cut across the ninth costal cartilage, and this is in contrast to the subcostal plane that cuts across the 10th costal cartilage. We'll talk also about the transpyloric plane in the next couple of slides because there are many structures related to the transpyloric plane. But one important thing to note about it is that once you cut across the transpyloric plane, that plane tends to lie halfway between the suprasternal notch of the sternum and the pubic symphysis. So it is just midway between the suprasternal notch and the pubic symphysis below. Then let's talk about the transtubercular plane. Transtubercular plane is also used in the formation of regions. So the plane is the inferior plane used in the formation of regions. It tends to pass through the iliac tubercle, hence the name transtubercular. So it's passing through the iliac tubercles. It cuts across the vertebral body of L5 and it lies midway between the transpyloric plane and the pubic symphysis. That's the transtubercular plane. In case we want to use a separate plane aside the transtubercular plane in the formation of regions, we could make use of the interspinous plane. Now, the interspinous plane is the plane that tends to pass through uh, the anterior superior iliac spine on each side, and it's a plane that is used as an alternative to the transtubercular plane. Then finally, we have the transumbilical plane. This is very straightforward. It is used in the formation of quadrants, and it's a plane that just cuts across the umbilicus. It lies between the vertebral bodies of L3 and L4, and it divides the entire abdomen into upper half and lower half. So this is just an image showing us some of the planes. In this image, you can see the transpyloric plane here. It's a plane that tends to cut across the umbilicus, uh, cut across the pylorus of the stomach rather. It's a plane that is found directly below the lower border of L1, as you can see. So this is L1. The lower border of L1 is where the transpyloric plane is located. The the transumbilical plane is also shown in this image. You can see the transumbilical plane cutting across the junction between L3 and L4. So this is L3, this is L4 here. And what we need to remember about the transumbilical plane is that the plane that cuts across uh, the umbilicus, as shown in this image. The other two three planes I mentioned are not shown in this picture, but we'll see pictures of them later on when we talk about the regions and the portals. Now let's turn our attention a bit to the transpyloric plane. Now, as I said, the transpyloric plane is located midway between the suprasternal notch and the pubic symphysis. But more importantly, there are structures that are found directly in relation to the transpyloric plane. And these are numerous structures we need to really pay attention to because they could ask you in your in-course questions. So starting with the first structure that is in relation to the transpyloric plane is the lower border of L1, as I showed before. The pylorus of the stomach is the next structure, and that is what gives the plane its name. It's called transpyloric because it's the plane that cuts across the pylorus of the stomach. Then the first segment of the duodenum is also in relation to that plane. The pylorus of the stomach becomes the duodenum, becomes the first segment of the duodenum at the transpyloric plane. The neck of the pancreas is related to the transpyloric plane. And then the fundus of the gallbladder is also related. Please remember it's the neck of the pancreas and the fundus of the gallbladder. You can always switch this in the questions that you tend to ask in your English. Other structures in relation to the transpyloric plane include the hilum of the left kidney, the superior pole of the right kidney. Usually the right kidney is a little bit lower compared to the left kidney. So as a result, the hilum of the left kidney is found on the transpyloric plane, whereas the superior pole of the right kidney is found on the transpyloric plane, so it's a bit lower. The origin of the superior mesenteric artery is also found there. Origin of the portal hepatic vein is found there. Termination of the mesenteric vein and splenic vein usually terminate to form the portal hepatic vein. As a result, they are found also at the transpyloric plane. The left colic flexure, also called the splenic flexure, is found. The right colic flexure, also called the hepatic flexure, is found. This is just the junction between the transverse colon and then the ascending and descending colon, respectively. Both of those planes, both of those structures are found at the transpyloric plane. The roots of the transverse mesocolon is also located at the transpyloric plane. All those structures you get to know when we go further in the module of abdomen. The cisterna child, which is the termination point or the origin point of of the the thoracic duct, is found also at the transpyloric plane. And then finally, the end of the spinal cord, which is called the conus medullaris, is also located at the transpyloric. So this is just another image showing us the different planes. You can see the planes that we could use in the formation of the regions shown in this image. We could either use the transpyloric plane, you can see the transpyloric plane cutting across the ninth costal cartilage here, running through the pylorus of the stomach, and running through the lower border of L1 in this image. Another plane we could use if we're not using transpyloric plane in the formation of regions. So costal plane, you can see it cutting across the 10th costal cartilage, so it is lower compared to the transpyloric plane. It's found below L2. It's found very around L3 vertebrae, and it tends to be cut below the inferior border of the costal margin. You can see the inferior border of the costal margin found around that in this image. Then the other two planes used in the formation of regions also shown. Intertubercular plane is shown above the interspinous plane. Intertubercular plane is a plane that cuts across the iliac tubercle. This is the iliac tubercle here. You can see that it's the plane that cuts across the iliac tubercle on both sides, and runs all the way down on the lower border of L5. Then you have the interspinous plane. The spinous plane cuts across the anterior superior iliac spine on both sides. This is the anterior superior iliac spine. So that plane just cuts across the anterior superior iliac spine on both sides, and it is also used in division of the abdomen into two. So we could use either of these plane when dividing the abdomen. We could use transpyloric plane together with the intertubercular plane, or we could use the subcostal plane together with the interspinous plane, or vice versa. But at the end of the day, what we do arrive at is a relation of nine regions of the abdomen. We'll talk about those nine regions very soon. In terms of the trans umbilical plane, this is used when we are forming quadrants. As you can see, it's just a single horizontal plane, which is the transumbilical, be used in the formation of four quadrants of the abdomen. Then let's finish up with the vertical abdominal planes. We have two types of vertical abdominal planes. We have the median sagittal plane. The median sagittal plane is used when forming the four quadrants of the abdomen. This is just a plane that extends longitudinally from the middle of the body all the way down, and it divides the body into right and left halves. So it is the perfect plane when dividing the body into quadrants. Then we have the mid-clavicular line or mid-clavicular planes. The mid-clavicular line of planes are bilateral. So there's the right mid-clavicular plane and there's the left mid-clavicular plane. This is the plane or line that tends to extend from the midpoint of the clavicle all the way to the mid-inguinal point. We get to know about the mid-inguinal points when we talk about the module under the inguinal region. But the plane cutting across the clavicle to the mid-inguinal region or mid-inguinal points is the mid-clavicular plane on the right side and the left side, and it is useful in dividing the abdomen into the nine regions. So this is an image of one of the median plane. You can see the median sagittal plane shown in this picture. Divides the abdomen into uh, quadrants, into four major quadrants. And for the mid-clavicular plane, you see two mid-clavicular planes bilaterally. So, like I said, the mid-clavicular planes and the line that is drawn from the middle of the clavicle at this point all the way to the mid-inguinal point at this point here. So you can see it on the right side and on the left side, and they're used in the formation of the nine regions of the abdomen. Let's talk about the regions of the abdomen. We have nine major regions of the abdomen. These regions are gotten when we combine transverse planes with the vertical planes. So when we combine two transverse planes, one above and one below, with two vertical planes on the right and the left side, then we will arrive at the formation of nine regions. So for the transverse plane, we could either combine the transpyloric plane with the um, transtubercular plane, or we could combine the subcostal planes with interspinous planes, or vice versa. The point is, combination of any of these two planes, superiorly and inferiorly, alongside the right mid-clavicular plane and the left mid-clavicular plane, will give us nine regions of the abdomen. So what are these nine regions of the abdomen? The nine regions of the abdomen includes the right, left, right and left hypochondrial region, the epigastric region in between, then the right and left lumbar regions with the umbilical region in between, and then the right and left inguinal or iliac region with the hypogastric or suprapubic region in between. I'll show you pictures about each of these regions tend to look like. So this is the depiction of the nine regions of the abdomen. We have the right hypochondrium on the this side and the left hypochondrium on this side, and in between them we have the epigastric region. Below we have the right lumbar and left lumbar, and in between them we have the umbilical region. And then finally we have the right inguinal and the left inguinal, also called the right iliac and left iliac. And in between them we have the hypogastrum or the suprapubic region. And you notice that what gave rise to these nine regions of the abdomen is the transpyloric plane superiority, transupercular plane inferiority, which are the two transverse planes, and then the mid clavicular planes on the right and the left side. And this is another image that is showing us the different regions of the abdomen. So in this image, we could also see that alongside the regions, we have the various contents of the abdomen being highlighted. So for example, in the epigastric region, you can see the stomach in the epigastric region and the pancreas just directly behind. You could also see the part of the liver extending towards the epicastrum. That part of the liver usually tends to be the left lobe of the liver. On the right hypochondrium, you could see that the liver takes a large chunk of the right hypochondrium, but hidden behind the liver is the gallbladder. So the gallbladder alongside the liver are found in the right hypochondrium. The left hypochondrium contains the spleen and some part of the stomach, as you can see. And then hidden behind that is the splenic flexure. Also on the right hypochondrium, maybe behind, hidden behind the liver is the right splenic, right hepatic flexure. When we drop down towards the middle of the abdomen, we would see the right lumbar, left lumbar, and the umbilical region. The umbilical region contains largely the small intestine and a bit of the transverse colon. So you can see transverse colon running in the umbilical region. You can see the jejunum, which is part of the small intestine, also within the umbilical region. When we extend to the right lumbar region, what we see in the right lumbar extend occupying the right lumbar region is the ascending colon. Directly behind the ascending colon, not shown in this image, is the right kidney. On the left lumbar region, we have the descending colon hidden behind. We also have the left kidney hidden there, and some portion of the small intestine also shown. Then finally, when we drop down to the lower part, the lowest part of the abdomen, we have the gastric region, also called suprapubic region. This region contains the ileum. So you can see it takes the large chunk of the hypogastric region. And then a little bit below that, you have the bladder. Behind the bladder, we have the rectum also taking this position. On the right and left side of the hypogastric region, we have the right iliac and the left iliac regions. The right iliac regions contain the cecum, which is the starting point of the ascending colon. So the cecum is found on the right iliac region. The left iliac region is going to be containing the sigmoid colon, but not necessarily shown in this image. So in females, we have some other structures that we tend to see in females. For example, on the right iliac and left iliac region, we will have the ovaries on the right and left side, and there's a part of the fallopian tube extending from there. Now let's talk about the quadrants of the abdomen. We have four quadrants of the abdomen. These quadrants are gotten from the combination of the transverse and vertical planes, particularly the trans umbilical plane and the median sagittal plane. So the combination of these two planes will give us four quadrants of the abdomen. What are these four quadrants of the abdomen? They include the right upper quadrants and the left upper quadrants, and then the right lower quadrants and the left lower quadrants. So this image is showing us the formation of the quadrants of the abdomen. You will see that the medium sagittal plane, which is the vertical line, combined with the trans umbilical plane, will give us a total of four quadrants. Right upper quadrants on this side, then the left upper quadrants, then the left lower quadrants and the right lower quadrants below. So these are a separate image of the quadrants of the abdomen. This particular image shows us some of the contents of the abdomen in relation to the quadrants. So for example, on the right upper quadrant, we have a number of structures, including the right lobe of the liver, or a large chunk of the liver, the gallbladder shown, the stomach, particularly the pylorus of the stomach, the duodenum, the first, the third part of the duodenum. The pancreas is also extending towards the right upper quadrant, and the right suprarenal gland also extends there with the right kidney and right hepatic flexion. Whereas some part of the ascending colon found in the right upper quadrant, so the superior part of the ascending colon, whereas some part of the right of the transverse colon, so the right part of the transverse colon found there. For the left upper quadrant, the organs that are found in the left upper quadrant includes the liver, just a portion of the liver, the left lobe of the liver, the spleen, a large chunk of the stomach, the jejunum, and the proximal ileum. The pancreas, particularly the body of the pancreas, is found here. Um, the body and tail of the pancreas is found on the left upper quadrant. The left suprarenal gland, the left kidney, the left or colic or splenic flexure, the transverse colon, particularly the left part of the transverse colon, descending colon, particularly the superior part of the descending colon, and then the so yeah, these are the major structures found in the right on the left upper quadrant. Going below, we go to the right lower quadrant. The right lower quadrant contains organs like the cecum, the appendix. You can see each of the organs there labeled there. In females, the right ovary and the right uterine tube. Most of the ileum is found in the right lower quadrant. Then the ascending colon, particularly the inferior part of the ascending colon, is found there. Um, and then we have the right ureter and then the right spermatic cord in males, and then the uterus, part of the uterus in females also found there. The urinary bladder, when it's full, tends to extend towards the right upper quadrant. So part of it is extended towards the right lower quadrant rather. So these are the structures found within the right lower quadrants. For the left lower quadrants, we have structures like the sigmoid colon, the descending colon, at the inferior part of the descending colon, as shown in this image, the left ovary in females, the left uterine tube, also in females, the left ureter in both males and females, the left spermatic cords in male, the uterus if it's enlarged, and then the urinary bladder as well if it's enlarged. Both the urinary bladder and the uterus tends to extend into the abdomen if they are both enlarged, um, and they would both be found on the right and left lower quadrants. So in this model, we talk about some landmarks of the abdomen. These are particular points that are very important in the division or the description of the abdomen and different organs within the abdomen. The most striking landmark of the abdomen is the umbilicus. The umbilicus is an indentation or on the lower aspect of the abdomen. It's one point we use in the division of the abdomen through the transumbilical plane. The umbilicus lies in the intersection between the transverse plane at the level of L3, L4. It is a dermatomal region that is innervated by the 10th thoracic nerve. That's very important to note in terms of your steeplechase. You could bring the picture of an abdomen or a specimen that contains the abdomen and then ask for the dermatomal innervation of the umbilicus. And that dermatomal innervation tends to be the 10th thoracic nerve. So please do remember this. It's the point. It's the point where the umbilical cord tends to enter into the fetus, and eventually, once the umbilical cord is removed, it leaves an indentation, sometimes a bulge, in the individual's abdomen. It is also located midway between the xiphoid process and the pubic symphysis, and that is one way to remember its location. So when you draw a line from the xiphoid process all the way to the pubic symphysis, halfway between that is where the umbilicus is located. The second landmark is the costal margin. Costal margin, remember, is the superiormost border of the abdomen. It tends to distinguish or divide the abdomen from the thorax. It's the inferior margin of the thoracic cage. The costal margin is formed by the costal cartilages anteriorly and extending from that to the 7th to 10th rib laterally, and then finally the cartilages of the 11th and 12th ribs posteriorly. So this is a picture of the costal margin. You start from the xiphoid process, extending from the costal cartilages anteriorly. Then from those costal cartilages, we drop down to the 7th to 10th ribs laterally. And then at the back, which is not shown in this picture, the costal margin tends to extend to the cartilage of the 11th and 12th ribs posteriorly. The third landmark of the abdomen is the pubic symphysis. It's the most inferior border of the abdomen. It is an easily palpable secondary cartilaginous joint found at the pelvic region or very close to the pelvic region that distinguishes or divides the abdomen from the pelvis. It lies between the pubic bones, and in this image, you can see the pubic surfaces in this part, this particular region. So it is directly um, in line or in between the abdomen above and the pelvis below. The fourth landmark is the linea alba. Linea alba is the midline fibrous band that extends from the xiphoid process down to the pubic surfaces. It's not visible to the naked eye, um, but it could be visible in situations where a woman is pregnant. Pregnant women tend to have their linea alba being becoming hyperpigmented. And in that case, we tend to call it a linea nigra. Linea alba tends typically just means white line. But in pregnant women, that line could become very dark, and we call it linea nigra, or a black line. I'll show you a picture of how that looks like in the next slide. So this is the picture of the linea alba becoming hyperpigmented in the pregnant woman. You can see how that line extends from the xiphoid process all the way down to the pubic surfaces. Then we have the aquate line being the fifth landmark. The aquate line, as well as the linea alba, are not visible to the naked eye. This line is important when discussing the formation of what we call the rectus sheath. We'll talk about that in the next module under the anterior abdominal wall. The aquate line is the line that tends to extend midway between the transpyloric plane and the pubic surfaces. So, way in which the umbilicus is extending from the xiphoid process to the pubic surfaces, the aquate line just below the umbilicus extends from the transpyloric plane somewhere around this point, all the way down to the pubic surfaces. So, midway between those two planes, transpyloric plane and the pubic surfaces, is where the aquate line tends to lie. What you need to remember about it is that it is important in the formation of the rectus sheath. We'll talk about that later on in separate model. The final landmark of the abdomen is the Magoni's point. The Magoni's point is the name given to the point over the right side of the abdomen that is one third of the distance from the anterior superior spine to the umbilicus. It's a clinically relevant line point or landmark in relation to the location of the appendix. It tends to be the point where we feel the sharpest pain in a case where the person is having an appendicitis. So in proper description of this line or this point or landmark, if we draw a line from the umbilicus as shown in this image to the anterior superior iliac spine, when we measure midpoint between the lateral one third and the medial two third, so this is the medial two third here, and then this is the lateral one third. Medial two third towards the umbilicus, and medial two third and lateral one third rather towards the anterior superior iliac spine. The midpoint between those two planes is what we call the Magoni's point. So some of the clinical significance of the abdomen includes number one, abdominal examination. For you to be able to diagnose conditions in relation to the abdomen or abdominal organs, we need to perform clinical examinations. And very importantly, the quadrants and the regions of the abdomen makes it easy in checking different organs within the abdomen. For example, when palpating for tenderness of the abdomen, we tend to palpate it by regions. So check each of the regions from the right hypochondrium to the right iliac or left iliac region. Another important clinical significance of the abdomen is in terms of acute abdomen, which is abdominal pain. The location of an abdominal pain could help us to identify the particular organ that is likely affected. So, for example, if you're having abdominal pain in the epigastric region, that could be due to problems with the stomach or problems with the pancreas, or if the pain is occurring at the right iliac fossa, that could be due to problems with the appendix or the cecum. Then we have other signs that are particularly important for specific pathologies like the Murphy sign and the Magoni sign. We'll talk about those signs in the next couple of slides. So this is the quadrants on the regions of the abdomen, particularly regions of the abdomen in relation to pain and possible pathologies that could be arising. So you can see in the epigastric region, you can have conditions with the esophagus, esophagitis. You have conditions with the stomach or duodenum, like peptic ulcer, perforated ulcer, or pancreatitis. If it's pain on the right hypochondrium, it could be problems with gallstones, cholangitis, hepatitis, liver abscesses, or even cardiac causes could be referred to the right hypochondrium. For the left hypochondrium, it could be a splenic abscess, it could be an acute splenomegaly or splenic rupture. Usually, left hypochondrial problems tend to be related to the spleen. On the right and the left lumbar region, usually those conditions tend to be in relation to ureteric colics, so problems with the ureter, the pyelonephritis, problems with the kidneys on the right or left side could present as pain on these regions. If it was at the umbilicus, the issues with the umbilicus could be in relation to appendicitis. Usually, early appendicitis is presented at the umbilicus, mesenteric adenitis, Meckel's diverticulitis, and lymphomas could present with pain on at the umbilicus. Then, with the right and left iliac fossa, for the right iliac fossa or right iliac region, could have appendicitis being a common cause, Crohn's disease, cecum obstruction, ovarian cyst in females, ectopic pregnancy in females, hernias could be the pathologies in relation to pain at that region. Then the left iliac fossa could have diverticulitis, ulcerative colitis, constipation, ovarian cyst, and hernias as well. And then finally, in the hypogastric region, the pathologies that could be present causing pain in that area could be testicular torsion in males, urinary retention, cystitis, and then placenta abruption in females. McBurney's point, like I said, is the point that is clinically relevant when talking about appendicitis. And palpation of the McBurney's point that elicits pain is suggestive of acute appendicitis. As you can see, when you touch that part and the person is feeling the sharpest pain around that region, that is significant of the point of acute appendicitis, and that is what we call the McBurney's sign. So we say the McBurney sign is positive when we palpate the McBurney's point and we feel tenderness there. Another important clinical sign that could be elicited in the abdomen tends to be the Murphy sign. The Murphy sign is used when it's seen for potential cholecystitis or what we call the inflammation of the gallbladder. This is done by palpating the right upper quadrant subcostal region. The sign is said to be positive when there's a significant pain that occurs while we are palpating that region and the person stops um, during midway or their breathing motion. Now let's try all these case studies to end this model. The case study here will show us different scenarios of individuals with pain in the abdomen, and we could think about the possible causes of this pain. Let's start with case one. A 55-year-old man has presented to the emergency department with abdominal pain and vomiting. He says that the pain came on gradually from yesterday. It was dull and constant. It's located in the gastrum at the center of the abdomen and it's related to his back. He has also had multiple previous admissions to the hospital, which were primarily related to alcohol excess. What abdominal organ is likely to be affected? Just by thinking about the organs located in the gastrum, the stomach, the pancreas, and then the right lobe of the or the left lobe of the liver, we could think about the possible cause. In the case of this individual, the particular cause would be a pancreas because pancreas is located in the gastrum, is found behind the stomach, so that's why the pain is going to be radiating more to the back and the pancreas tends to be affected with excess alcohol intake, and that's what clinched the diagnosis. So this patient is likely suffering from acute pancreatitis. So case two is the case of this 44-year-old woman that presented to the emergency department with 1 day history of constant abdominal pain and vomiting. She is the patient that is febrile, a temperature of 38 degrees centigrade was noted, pulse rate of 116 per minute, and she is not clinically jaundiced on examination. She was found to have tenderness on the right hypochondral had right upper quadrant rather, which is worsened by placing two finger breaths on the tip of the ninth costal cartilage during inspiration. What abdominal organ is likely to be involved? So note that she's having pain on the right upper quadrant and she's having fever spikes alongside the pain. And a sign was elicited by placing the tip of the finger on the ninth costal cartilage on the costal margin while she was expiring. This is what we call the Murphy sign, and Murphy sign is suggestive of acute cholecystitis. So the abdominal organ affected is going to be the gallbladder. This makes a lot of sense because the gallbladder is found on the right upper quadrant, and problems with the gallbladder is listed by the performance of a Murphy sign. Case three is the case of a man that was rushed to the A&E on account of fever, abdominal pain, and jaundice. Jaundice is yellowish discoloration of the eye that occurs when bilirubin is not properly processed or excreted from the body. He has a temperature of about 38 degrees centigrade and tachycardia of 120 per minute. We all also noticed the yellowish discoloration of the eye and sclera, and then discoloration of the skin as well. Abdominal examination revealed that he had maximal tenderness in his right upper quadrant. What organ is likely implicated? So the organ likely implicated could either be the liver or the gallbladder or the biliary tract or the bile ducts. So each of these organs are found within the right upper quadrant. But in the case of this individual, it's likely to be the liver, as the person is also coming down with fever. So fever, abdominal pain, jaundice could point to the liver or could point to the gallbladder. So you could have hepatitis be the cause. You could also have cholecystitis or even cholelithiasis being a cause of this condition. Case four, we have a 22-year-old woman that presents to the emergency department complaining of lower abdominal pain. This has steadily increased in severity over the previous 24 hours, and she woke up from sleep as a result of it. Uh, her blood pressure was 110 to 72 millimeters of mercury, and pulse was 110 per minute. She had temperature spikes of 38.2 degrees centigrade. The pain is said to be located at the lower abdomen. When we checked on examination, she had lower abdominal tenderness. There was more to the left iliac fossa with some rebound tenderness. So at least the abdomen is likely involved. Please make important. It's very important to know that this is a female we're talking about. So the likely possible cause would be an ovarian cyst. She could have a problem with the ovarian cyst. She could have an ectopic pregnancy. She could also have problems with the descending colon or the sigmoid colon. She could have a diverticulitis. So the organs affected are organs specific to the left iliac fossa. So the descending colon, the sigmoid colon, diverticulitis, the left ovary, which is could be an ovarian cyst, the fallopian tubes, which could be an ectopic pregnancy, or even a sarcopenitis, which is the inflammation of the uterine tubes. The last question here is case study of a 19-year-old man that presents with 2-day history of abdominal pain. Pain started in the center of the abdomen and has now become constant and has shifted to the right iliac fossa. The pain caused him to have vomiting twice today, and it, the vomiting contains recently ingested food. His motions were loose today, and he but had no associated rectal bleeding. On examination, patient had temperature of 37.8 degrees centigrade, so that was low grade fever. It had pulse rate of 110 per minute. On examination, his abdomen was had localized tenderness and guarding in the right iliac fossa, and urinalysis is clear. So meaning it's not was not likely to be urinary urine related problem or urinary tract infection. On investigation, the white blood cell count was 19 per 10 raised to power 9 as elevated. Normal is meant to be from 4 to 11. And then the C-reactive protein was 20. Normal is meant to be less than 5. So what organ is likely affected? So think about the organs found in the right iliac fossa. We have the appendix, we have the cecum, we have the ovaries in the females, but particularly this particular case study is a case study that depicts a 19-year-old male. So this is likely not going to be an ovarian cyst. The likely diagnosis in this patient is an appendicitis because of the way in which the pain tends to shift. Although in McMoney's point, sign was not done, but if you notice, the pain shifted from the center to the right iliac fossa, and that is particularly seen in appendicitis. Alongside that, he's also having problems with his white blood cell counts and C-reactive protein, which shows an inflammation ongoing. So this is the case of an appendicitis. So all these case studies just to show that we could use the regions and the different quadrants of the abdomen in the diagnosis of patients with various conditions of the abdomen, like appendicitis, like peptic ulcer, like hepatitis, and the rest. And that concludes our module on the introduction to the abdomen.